Okay, Chapter 6, Dr. Landreth, Play Therapy, the Art of the Relationship for the Marriage and Family Play Therapy course, The Play Therapist. The beginning of this chapter, Dr. Landreth gives a scenario about creating differences. If the child wants to paint the sky green and the grass blue, Dr. Landreth's thought is that freedom for self-expression should not be violated. Once you begin to tell a child, no, you're doing it wrong, any chance for a therapeutic relationship or response in the session has been contaminated. The play therapist is intentional about creating a safe, accepting, sensitive, unique environment. Creating differences and fully being there, fully being present, not on the phone, not correcting, not taking notes, but intently observing, empathically listening, encouraging, recognizing not only the child's play, but the wants, needs, and feelings expressed underneath the play. Understanding the child, the personality characteristics of the child, understanding our own characteristics of being mindful and intentional, not just the attainment of describable dimensions and goals, but objective and flexible enough to allow the child a safe place to be a separate person, even if some of those things that come out are not socially acceptable, but a place for the child to at least express those things. How the therapist feels about the child is more important than what the therapist knows about the child. An unwillingness to judge or evaluate, just looking for an experiential understanding of the therapeutic relationship as it is. Open-mindedness. Openness and sensitivity to the child's world are prerequisites, related to based on the basis of their own merit alone. High tolerance for ambiguity. Entering the world and experiencing the client's world as a follower, not a leader. With future-oriented. Understanding the past, living in the present, planning for the future. Personal courage, admiring and encouraging the child and giving the child acceptance for having the personal courage to make mistakes, to be vulnerable, to tell their story, to come into a place where there is tolerance for risk-taking behaviors with a high degree of patience, genuineness, authenticity, the act of being real with the child, warmth and caring, acceptance, empathic understanding. On page 101, Helen Keller says in 1954, "Once I knew the depth where there no hope was and darkness lay on the face of all things. Then love came and set my soul free. Once I fretted and beat myself against the wall that shut me in. My life was without a past or future, death a consummation devoutly to be wished. But a little word from the fingers of another fell into my hands that clutched at emptiness, and my heart leaped up with the rapture of living. I do not know the meaning of darkness, but I have learned the overcoming of it." A lot of our clients come to us from a very dark place, a helping hand to be able to bring them into light and understanding. The therapist must be personally secure, recognize and accept personal limitations without threats of inadequacy. Therapist self-understanding. Therapist self-exploration, to know their own motives and needs. What needs of mine are being met in therapy? Am I meeting my needs or the child's needs? How strong is my need to be needed? Do I like this child? Do I want to be with this child? Will my attitudes and feelings, how will those things impact this child, and how am I perceived by my child, by my client? That self-exploration is a very important piece for us to be effective with any client. Do we have an intent to change the child? Do we hope the child will do something in some way? Are we accepting of some behaviors and not others? Do we have a very low tolerance for messiness? Do we have a high need to rescue a child from pain or difficulty? Do we want to be liked? Do we feel safe? Do we trust the child? Do we expect the child to deal with their issues in the way that we want them to deal with those issues? Only when a child feels free not to change, then genuine change is possible. You cannot pressure someone to make a change. Change comes from within. You cannot accept another person's weakness until you're able to accept your own. The role of the play therapist is not a supervisor, teacher, peer, babysitter, or parent substitute. We are counselors. The prophet stated in 1923, "No man can reveal to you anything about yourself but which already lies asleep in the dawning of your own knowledge. The wisdom of one man lends not its wings to another man." Everyone must be able to do the things that they do. On page 110, there is Ryan, a child who is dying with terminal disease, in play therapy. It's a case study. And it goes through page 116. Supervised practice facilitates self-insight. There is another case study for around Margaret, Keith, and Douglas, who are all play therapists in their own personal experiences, as well as Ching. The inner struggle of a beginning play therapist. What is play therapy? How do I work the different interventions? How do I know if the child is benefiting? Recommended training programs. Master's degree. Content areas in child development. Theories of counseling and psychotherapy. Clinical counseling skills. Group counseling. Content area equal to 90 clock hours of instruction. The Play Therapy Association requires 150 hours for you to be a play therapist. Counseling, observation, case analyses, observation by experienced play therapists, supervised experience with someone who has a play therapy certification, to observe play therapy sessions and videotapes and critiquing videotapes. One of the reasons that we have this requirement in our syllabus. Observation of current play therapy sessions by peers, role plays, conducting volunteer work. All of those things will guide you into an experiential perspective on how to become the best play therapist that you can. We will reconvene with Chapter 7. Thanks again.